Hey guys, Jessica here. So today I want to talk about postpartum mamas and kind of what the norm is to expect. If you think about it, these poor mamas, their blood volume has gone up about 50 to 60%-ish during this pregnancy, and they've gained all kinds of blood volume because they're supporting this little baby. And so once the baby is delivered, they're going to have a decrease in their blood volume, and they're going to have a decrease in their cardiac output, which is going to lower their heart rate. So it's quite normal that a mom would be bradycardic, maybe 50 to 60 beats per minute for the first 48 hours while she is healing and recovering. And the body is an amazing thing. So the two main things our bodies are going to do to offset this fluid loss, to get fluid balance back, is diurese. So she's going to pee a lot, and she's going to diaphoresis, which is sweat. So you're going to see sweating and peeing quite a bit in the beginning. The other thing to remember is during pregnancy, these moms have released high clotting factors, so they're very prone to having blood clots, but their body's not breaking them down. So that is why it's so important you get your moms up and moving. If they're a C-section, you want to get them like the scud machine or something to help prevent the DVTs and prevent possible clots. And remember just kind of your signs to assess for that. So normal vital signs for a mom. So if you think about it, her body has been damaged. She has inflammation in her tissues. The tissue damage alone has caused an inflammatory response that the body is trying to repair. So it's quite normal that she could have a slight elevated temperature as her body is trying to heal. But if it's over 100.4 or 38 degrees Celsius, there's where you want to be concerned, because you're thinking more along the lines of infection versus healing. Remember, her heart rate is normally bradycardic, so if she's tachycardic, that may indicate that she's got hypovolemia or a possible infection as well. And the blood pressure pre-delivery can be slightly decreased due to the progesterone, like relaxing the blood vessels. So her blood pressure might be a little bit low. So you're going to want to do a full head to toe assessment, and you're going to assess the mom with the bubble method. So if you think you have bubble spelled out all the way down, B-U-B-B-L-E. B is for breast and nipples, U is for uterus fundus, B bladder, B bowel, L lochia or discharge and bleeding, and then E for episiotomy. So for the breast, they should be soft for the first couple days and then start getting firm. They may get engorged, and you want to check to make sure there's no cracking, bleeding, the nipples aren't red or inverted, and you want to teach the moms to not use any soap on their breast because it can really dry their skin out. The uterus should return to its non-pregnant state. It decreases about 1 finger width per day. And one big thing that's normal, especially moms that have had multiple babies, they've had several babies before, when they breastfeed, that triggers the release of oxytocin. And that's going to cause the uterus to contract. So most moms, when they're breastfeeding, they will get cramping in their abdomen, and that is totally normal, but it's just something they kind of have to work through while they're feeding. Now, after delivery, you want to check the fundus. Is it firm? Is it boggy? You want to kind of check that. Right after delivery, it should be about a finger width above or right below the umbilicus. It should be right in there. And it takes a little while to work itself down. The lochia, we talked about that for the bleeding. So lochia rubra is bright to dark red, and that takes about the first 1 to 3 days. Lochia serosa is like a pink to brown color, 3 to 10 days. Lochia alba is this mucus clear or like white color, 10 to 21. So it's 1 to 3, 3 to 10, 10 to 21. And it depends on the patient. You don't want them to soak a pad. You want to check the bleeding. If they're soaking a pad in an hour or even in 2 hours, you want to be concerned that they're possibly hemorrhaging. And then you want to be checking their perineum. If they had a episiotomy, offer, ice or sitz bath or things like that. They can get hemorrhoids. You also want to make sure they don't get constipated, so they'll do stool softeners and stuff to help out there so there's no straining. And with their vaginal area, it's going to be more dried out after birth, so you want to let them know that they're going to be more dry. They shouldn't use tampons or have sex for 6 weeks, and when they do go to have sex, they need to use like KY jelly or some kind of lubricant to help out with the drying. So with the heart, 50% increase in blood volume happens And then the baby's born and they have this major fluid shift. So they're going to be diuresing, right? And then the other one, diurese and diaphoresis. So they're sweating and they're peeing quite a bit. And you want them to kind of sit, stand, and move slowly because of with the different blood volumes, they could get orthostatic hypertension. So have them take it easy. And then because of the blood volume, the hematocrit is probably going to be low. So it's normal. That's going to take up to 8 weeks to like go back to normal. So hemoglobin hematocrit's usually checked in the first 24 hours. You're watching white blood cells too, making sure they're not increasing too high, indicating possibly an infection. And that is all I have for you guys today. So I hope this helps.